Everyone. It's been a while since I posted my last video. I hope you had a chance to watch all my videos posted earlier. Today we'll be looking into an important topic called types of dementia. But before I move on to that, I just wanted to share a very important piece of information about our human brain. Now, our neurons, I spoke a lot about our neurons, right? Our neurons of our brain are actually amazingly adaptable. In fact, scientists have discovered that our brain actually has what we call it as a neuroplasticity, which provides an opportunity to retain some of the habits, or rather create new habits. That's one of the reasons why many people who have had accidents, many people have had suffered some injuries on the brain, actually have been able to recover some of the senses only because of this wonderful treasure that our human brain possesses, which is the neuroplasticity. Now, this neuroplasticity is also an important, knowledge that we need to possess, particularly when it comes to understanding dementia. Because when a person suffers from dementia, as I told you earlier, there are possibilities of the person suffering from dementia to lose many of the senses because of the damage that's been done by the disease. But with the help of this neuroplasticity, it is possible to gain some areas of the senses, or at least we can try to protect some part of the brain from getting extensively damaged. So that's a very good news about the human brain, and particularly with respect to the neuroplasticity. Scientists have also talked extensively about the cognitive reserve. Now, that cognitive reserve is what you basically do when you spend a lot of time in activities that trigger a lot of information in the brain. And that particularly happens between the age of 30-35 to the age of 50. Now, when we do that and you have enough cognitive reserve, people say, and scientifically it's been proved, that the dementia, possibility of the incidence of dementia affecting a person actually is very low. So this is definitely a very good news, particularly with respect to the research that's been going on around dementia. So please do spend a little bit of research on this particular topic called neuroplasticity, and how does it help the people who are affected by dementia. Now I'll be delving deep into the types of dementia, the causes of dementia. There are primarily four causes, and I'll be showing that through an important slides which I want you to watch. Well, I have talked a lot about the kind of symptoms that a brain undergoes due to various reasons of the impact that it has because of the severity of the dementia. This particular slide basically talks about the types of dementia. Now, predominantly, close to about 60 to 75 percentage of the people who get dementia actually suffer from the Alzheimer's disease, which causes dementia. Now, schizophrenia, you would have heard about this term. The schizophrenia and the Alzheimer's basically share a lot of common symptoms. While schizophrenia starts early, the Alzheimer's disease actually starts much later in the old age. So that's one type of dementia. Now, the next one is the frontotemporal dementia. When we saw the parts of the brain, we saw that. Now, the frontal part and the temporal, parietal lobe and the frontal lobe and the temporal lobe, they get affected because of this dementia. Now, that's another type of dementia. Then we also have Lewy body dementia, the vascular dementia, and mixed dementia. Now, mixed dementia is one in which a person can actually have symptoms from all or more than one type of dementia. We'll see all of them as we move forward. Now, the Alzheimer's disease. Now, if you look at this brain here, this is the healthy brain of a human. Now here are the connections. Now here in the center part where we see it's the healthy neuron. Now once a person gets affected by Alzheimer's disease, now you can see the size of the brain actually shrinks. Now that happens because of the plaques and the tangles that actually causes the neurons to die. And as the neuron starts dying, people lose the ability to perform certain executive functions. Now, some of the common, symptoms of the Alzheimer's disease are given here. But before we look into that, as I said, 60 to 70 percentage of the reason for dementia is because of the Alzheimer's, and it's a progressive and a degenerative condition. A progressive in the sense that it does not come down, it just progresses. The disease actually moves forward, and it also degenerates the brain, so which means the person loses the ability to perform a lot of functions. So some of the symptoms are deterioration of the ability to form new memories, and that happens because of the hippocampus, which I was talking to you about in the last video. The deficits in the logical thinking and planning, so this also gets affected, so the person finds it very difficult to make decisions. They are also lost in space and time, so they actually don't know where they are, they forget the space, they also don't know much about the time, the day of the the day, whether they are in the evening or in the morning and things like that. They also have language difficulty. Sometimes they find it a bit difficult to communicate. Sometimes they forget the language, words and what words to use and things like that. Then the personality also changes. Sometimes they become moody. Sometimes they become very irritated and annoyed. They actually start shouting. They start yelling at people, or they may go into depression and start crying for no reason and things like that. They also have a lot of confusion. Now, the main reasons why this happen is because of the amyloid plaques, which affects the hippocampus, and the hippocampus is very essential for forming new memories. Now, once a person gets affected with Alzheimer's, this actually happens, and because of this, the person sometimes even forgets a lot of things. So you may have to repeat a lot of things to that person. Now, the symptoms of Alzheimer's actually starts many years before we even could identify them. That's one of the reasons why we need to be very alert, particularly about identifying the symptoms. When we see minor changes, it is also important why you should know more about these kind of diseases, because when you notice some changes in somebody, you can immediately start the diagnosis. Now, there's nothing for you to panic, but at least when you start the diagnosis, it helps you to know the healthy status of the brain. Now, this is when the symptoms start shows much earlier. We call that as the preclinical stage of the disease. Moving on to the next one is the frontotemporal dementia. Now here also you can see, in this picture, this is the frontal lobe and that's one is the temporal lobe. Now the frontal lobe and the temporal lobe is a healthy brain. This is the picture of a healthy brain. Now when the person gets affected with frontotemporal dementia, you can see again the brain actually shrinks. Now it particularly affects the frontal lobe and the temporal lobe, so which means what, the person loses the ability or the executive functions that are being performed by the frontal lobe and the temporal lobe. So that's something that you will notice in the person. Now it occurs to majority of the population under the age of 65. Now, excuse me, now a few cases have also been reported beyond 65 years as well. Now it affects the frontal and the temporal lobes of the brain. Now some of the symptoms can be the personality and the behavioral changes that you may notice in the person. They may not a person who was jovial may not talk much to people. They may avoid eye contact, and things like that. They also have the same symptoms, like they have problems with planning and judgment, what decisions to make. They'll also be very apathy. They also will have very apathetic about what is happening around them. They may not understand the human emotions. Like, they may hurt you but they may not even know, or they may not even understand, or they may not even worry about hurting somebody. So they also will lose their empathy, so which means they do not care or understand about what or how other people or caregivers feel about themselves, or or even get affected by them or about them. They also have disinhibition, so they may sometimes have no fear at all, and they may also lose the connection with the nearby environment and things like that. And some people actually have started exhibiting a lot of changes, particularly with respect to their diet. So they may start eating more, and particularly sweet. So because of that, they may actually become diabetic, or if they have diabetes, the diabetes may increase, and sometimes they may also put on weight that can cause further issues to the body. The next one is basically the Lewy body dementia. Actually, my mother, suffers from this, and this has, a very close connection with the Parkinson's disease. Now, here is the thing that you can actually see. Now, it's the expansion part of this is the next picture. You can see, that's the nucleus, that the healthy brain. Now, that particular neuron gets actually affected because of something called something that actually called as the Lewy body. Now that actually affects some of the functionalities of the human brain. Now, if you notice, it's a progressive, basically progressive and an incurable disease with severe and several physical and cognitive decline. In fact, I'm able to see, that in my mother also. She finds it very difficult to communicate. Her language skills have gone down. She's unable to identify letters, and she also finds it very difficult to write. But sometimes she reads well. Sometimes she finds it a bit difficult. So you will see this, rise and fall in the cognition. And the next to Alzheimer's, this is the most common dementia that affects people. Now, as I said earlier, that Parkinson's disease and the Lewy body disease appear to have closely related conditions. So people who have Parkinson's plus or Parkinson's disease also get sometimes or most of the time get affected by dementia. Now, what are the symptoms that you can actually see? There is a fluctuation in the cognitive change, which means what, sometimes they may actually be very alertful. They may respond to a lot of your requests and questions, and you may feel happy about it, but the next day or a few days later they may actually lose their ability. So you may even wonder, like, whether the medicine works, or are they doing it wantonly and things like that. They also lose their attention, so sometimes they may not even respond to you, or sometimes they may not even respond to the situations around them. It also changes their visual and the spatial awareness, so they may not be able to see they may have difficulty in identifying the distance of an object, whether it is near them or apart from them. They may also lose the connection with the spatial that distance and the geographical connections and things like that. They may also have visual hallucination. Now, this is something that my mother also had. So where they are able to see, people, or some images in front of them. And they also will have sleep disorder, so they may not be able to sleep well. And due to the issues with respect to the time, they may ask whether they can sleep in the morning, they can sleep in the afternoon. Such issues you may have. And they may also experience a bit of tremors, so the hand may shake. There may be a shivering. They may not be able to hold objects properly and things like that, so which means it requires a lot of physical activity. Of course, all the dementia people who are affected by various dementia definitely need to do a lot of physical activity. But when they are affected with Parkinsonism, it is important for them to do all this physical activity. They may also have memory loss, because it also affects the hippocampus, as I said earlier. So sometimes they may not remember
what happened in the past, or sometimes they may not remember what happens, in the present. So that, something that you may get affected. So they may not be able to recognize faces, they may not be able to recognize events, they may not be able to remember a lot of things. And so whatever that we have seen in the Alzheimer's disease, some of the symptoms they actually show in the Lewy body dementia as well. And the next one is the vascular dementia. Now, here, vascular dementia basically talks a lot about the blood circulation. So, our body receives the blood, right? So, the heart pumps, and the arteries also pump the blood. It receives it, receives the blood, and then it pumps it to the different parts of the body. Now, the brain also receives, the blood, right? The blood circulation. Now, when there is some kind of a damage that has happened, to the brain, due to various reasons, then that causes dementia. Now, I'll be going through that. It is basically caused by damage to brain cells, which is deprived of the blood flow and the life-sustaining oxygen and nutrients. So, when the blood is circulated through the human body, when it reaches the brain also needs to receive those nutrients and the oxygen, right? So when something kills or something damages that part, then the brain cells are deprived of that blood flow. So that's when this kind of dementia actually happens. Now it happens because of a block. Now, the blocks can be caused due to various reasons. While we will see how the particular dementia affects the brain, the it happens because of the accumulated damage to blood cells, and the blood cells could have got damaged due to various reasons like accidents and things like that. Then the symptoms that they show are the stepwise pattern of degeneration. It slowly people start to lose a lot of the executive functions of the body, some of the things like speech and things like that. They may also have problems in gait, the way in which they walk. They may not be able to walk properly, and there's also a possibility of them getting problems with the mood and the behavior. Sometimes they may be violent, sometimes they may be very passive. They may become very anxious and depressed and a lot of other things. It is a kind of a small, it's a vessel disease, so which means they may also experience that. So which means they will show a lot of. So basically, this small vessel disease, it damages the wall of arteries and capillaries and vital organs, and particularly it is connected with the brain and the heart. So that's something that is a symptom that you will experience, and because of that they may also experience various other problems. Now, how does the brain get altered because of this? Is that sometimes it's because of the strokes, which is called as the infarcts. I've given the description for that. I'll just read it out. A localized area of dead tissue, which is the necrosis, in an organ or part of the body. Now, that's what we call it as the strokes, right? It occurs when the local blood supply is severely restricted or cut off, depriving the tissue of essential organs and nutrients. So that means it starts to die. So when it starts to die, the connection also gets damaged, and when the connection gets damaged, the people may lose the ability to do a lot of activities. Now, there is also something that is happens to the brain. It's called as the white matter disease, which is an umbrella term, that's being used for the damage that is done to the brain's nerve fibers, which is the axons. I didn't talk much about the neurons and its connections. That how one neuron connection happens with the other one. I didn't talk much about it because it's too technical, but these are the nerve fibers which are very essential for the the communication between one neuron and the other neuron. Now that rely on the protective sheath called myelin to communicate. So now that gets altered because of this vascular dementia. And the hemorrhages, which can be a medical emergency where a blood vessel bursts or leaks inside the skull. This can happen because of people experiencing accidents, where the skull gets damaged, and because of the high blood pressure, it can weaken the blood vessel. So that's one of the reasons why people who suffer from dementia, they go through the blood pressure test, and their blood pressure shouldn't also be more, so it should be maintained properly, so which can lead to microbleeds or hemorrhages that will destroy the adjacent brain tissue. So as it's kind of damages one tissue after the other, so the people actually start to lose the connection, and when they start to lose the connection, it actually affects the executive function, or it damages the entire the capacity to function also. So which means the person will be more dependent on others for their everyday activity. Now, mixed dementia again is something that a condition in which a person has more than one type of dementia. People say that the common combinations are the Alzheimer's and vascular, and some combinations are possible as well. Now, some of the overlapping symptoms that you may see, with the person who's affected with mixed dementia is that the cognitive issue, which means there is a severe short-term memory loss. They may also have a difficulty in concentrating on various aspects, which can be listening to conversations or doing activities on a daily basis and things like that. And they may also have impaired problem solving or language skills. They say they may not be able to communicate. Sometimes they may be able to communicate through verbally, but they may not be able to write, or they may not be able to communicate verbally. They may be able to write, or it can be both. Then they may also experience behavioral symptoms like mood swings and depressions and apathy, and the personality changes. They may also have physical issues like balance problem, difficulty in walking, and sometimes they may also have declines in health because of minor strokes. So these are some of the symptoms, but people who are experiencing both, the combination of multiple dementia will show a lot of symptoms. So which means they may show, for example, here I've said Alzheimer's and vascular, so which means the person will show some of the symptoms of Alzheimer's and some of the symptoms of vascular dementia as well. Now, before we conclude, I just wanted to touch base a bit on the hallucination and delusions which people experience, particularly, then when they undergo psychosis. Now, both are symptoms of psychosis which many dementia patients exhibit. Now, what are hallucinations? They are basically hearing voices or seeing things that they are untrue, and they won't be able to accept it. While you may say it is logical that they don't see any object, but how is that they are able to actually hear voices? For them, it is like us talking to normal people. So they will never be able to understand and differentiate between what they see and what they are not able to see, while they will still continue to hear voices. And the delusions are unshakable false belief that persists despite clear evidence on the contrary. You may even say, I've told my mother has both hallucination and delusion. You may even say, Amma, do you see that there is no person here in front of you? You're also not talking to somebody on the mobile. So you don't have a mobile phone. You don't see somebody. So how is that you're able to hear the voices? So why are you even talking to them? They may accept it. Yeah, I don't have a mobile phone. Yes, I don't see anybody. But after some time they'll immediately start talking. So that is something that affects the people who are suffering from dementia as well. Now with this, I know it's a bit longer, but with this I would ask you to delve a deep into understanding more about the different types of dementia, and what kind of symptoms the people experience, and you may also study a bit about depending on the type of dementia, what part of the brain actually gets affected, so that you will be able to support the person who is affected by dementia in a better way. So thank you so much for listening to my video. and this presentation as well. I would urge you to spread this information to as many people as possible. As I've always said, and whatever information that I'm sharing, it actually is from my personal experience and my interest to study further with theory. But I would still urge you to consult a physician, to understand about the diagnosis. And if at all you see someone, loved one, or you experience some symptoms, you please consult a doctor to understand, whether it is really really dementia or something else. Thank you so much. Until we see next time, it's bye from Murli.